Hey there. My name is Dr. Cozy. It's really nice to meet you. Really quickly, can I just have you verify for me your name and date of birth? Perfect. Okay. So, looking at your paperwork, it says that you feel like you have something stuck in your eye. Okay. How long do you think it's been in there? And what were you doing when you started feeling like something was in your eye? Okay. So then do you have an idea of what it could be that's in there? Okay, not really. That's fine. I'm sure it's uncomfortable, but would you say that it's painful? Okay. And is that pain radiating like up into the forehead, towards the ear, down into the cheek? Okay. On a scale of 1 to 10, how would you rate the pain level? And have you tried anything to remove it or flush it out? Okay. Well, it's worth the effort, but I'm sorry it wasn't productive for you. The first thing I want to do is actually take your temperature, if that's okay. Our bodies don't like foreign objects, and also it can introduce bacteria, so I just want to make sure that there's no immune response going on. Can I just have you open for me? Perfect, thank you. Well, temp's in normal range, so that's good. 98.4. Okay. Let's take a look at you, okay? So, do your best just to look straight ahead, okay? And if it helps, maybe direct your gaze right in between my eyebrows. Just gonna see if maybe I can see anything. Can I have you look up? Look over here at my finger. Okay. And then at this one. I'm not seeing anything. I'm going to take a look at your eyes with my fundoscope, just because I want to make sure that there's no damage or trauma to the actual internal structures. So again, just gaze right ahead. Okay, and just I'm not some gloves on. If it's alright with you, I would like to palpate around your eye. Just see if I feel any kind of swelling, any temperature changes, anything that would be considered atypical. Okay? If at any point this is uncomfortable, painful, please let me know. Compare the sides, tell the temperature here. Sorry, I had a bit of a nose whistle there. It's that time of year where we have the cottonwood trees, or maybe they're dogwood trees, that release that kind of cottony pollen everywhere, and I think it's pretty killer on everybody's allergies. Can I have you close your eyes for just a moment? Thank you. You can open. So without turning your head, I would like you to follow my finger with your eyes, okay? I want you to tell me if you feel anything while your eyes are looking in different directions. So, anything? Okay. So what I would like to do is to administer some eye drops. They are really good at lubricating the eyes, and you can actually buy these at pretty much any pharmacy, which I would highly encourage you to do. They're these Refresh Plus, okay? And they come in sort of single-use little ampules like this. And they're really wonderful for tired eyes, but they can also be useful for helping us flush. So I'm going to tip your head back if that's okay, so that way I'm able to administer the drops. Okay, so, alright, you comfortable lying back like that? Okay. How are you with eye drops? Would you prefer that you close your eyes and then kind of blink it into the eye? Okay, so close your eye. I'm going to drop this right in the corner of your lid here. Just like so. dab away the excess. Open. Okay. Now, can you look back and forth for me? Good. And have you look up. I'm gonna grab something here. So I have this little kind of forceps, but what it does is it helps keep your eye open, okay? So I'm gonna have you look up for me. Perfect. Alright. Let's have you look down. Couple more drops, okay? Open your eyes and blink. Okay, let's take a look here. Look up. I'm kind of hold your lid up with my finger. Can I have you look down? Relax your eye. We're going to do one more set of drops here. So close. Okay. Open and blink. Look up. Look to your right. And then to your left. Okay. Blink a few times. Okay. Open. I'm not seeing anything here. Alright, let's sit you up. Okay. Hopefully that wasn't too uncomfortable. A little, I'm sorry. So, okay. What I'd like to do now is I'd like to maybe try using some heat, okay? I have these hot packs, and don't worry, I have a little sleeve that it fits into to help and protect your skin so it shouldn't be too warm. But I'm hoping maybe with some heat we can encourage whatever's in there to find its way to the front so we can get it out, okay? Okay, so I just need to activate this. So first off, can you tell me, is this too warm? Okay. You sure? Because I can put another drape around it. Okay, that's fine. So I'm just going to place this, yeah, close your eyes, right over your eyes here. And if at any point this feels too warm, let me know. Actually gonna stand up. I'm at a better angle. It's starting to feel warm. Okay, let me wrap it for you. Okay. How's this? Is this better? Okay, good. How are you feeling? Okay. So, I'm gonna try something. So these applicators are sterile, or they were until I opened it, but nothing has touched the tips here. All right. I'm going to get it nice and saturated. So now what I'm going to do is I'm going to stick it in the very inner corner of your eye. I want you to blink down on it, and I'm going to sweep it across, okay? Okay. So, blink. Good. blink down on it. Blink. Let's get a new one. Okay, here we go. Blink. Give it one more go here. Blink. Can I have you open wide and look up? Can you feel about where you think it might be in your eye? Is it up or down? Okay. Have you close your eyes for a moment and kind of look back and forth? Good. Open. Look up. Okay. I'm gonna use this again, okay? So, look up for me. Good. Can I get you to look down? Okay, up again. Left. And right. Okay. I think I see part of an eyelash, and it's right over in this region. So let's have you look up again. Yeah, there she is. Okay. So, can relax your eye for just a moment. Get a new one of these. Okay, so this may not be the most comfortable thing, okay, but I want you to do your best to bear with me. So, open your eyes wide. I'm gonna use my finger to kind of pull your lid down. Try to resist blinking. I know it's gonna be really hard. I know. We got it. All right. Good job. So, blink a bit for me, okay? Your eyes are going to probably be feeling a bit sensitive, which is totally normal. So I just need to do a really quick eye exam with you, okay? Because I just want to make sure that we don't have any damage. So keep your eyes open and just focus right between my eyebrows. Good. Okay. Tell me when you see my light enter your field of vision. Okay. Tell me when you see it leave. Good. Tell me when you see it again. And tell me when you see it leave. Good. Okay. So, see my finger here? I want you to follow this using your eyes. Don't turn your head. Were there any times where it felt like your eye was catching, scratching, or just uncomfortable? Okay. Good. Okay. This is the last bit I'm going to do with the light, so do your best to try to keep your eyes open, okay? So, are you able to see my chart here? Okay. Whichever line you're able to read most comfortably, can you read for me? Okay. Are you able to read any here? How about here? That's okay. Don't worry about it. Okay. Can you recognize what color this line is? How about this one? Good. Okay. So it doesn't appear that there's any kind of specific damage to your eye, which is good. So, let's just take a look here at your chart. So, under medication allergies, you left it blank. So, does that mean that you don't have any? Okay. I just wanted to verify because sometimes people miss things in our paperwork. It is quite extensive, so I don't blame them. What I would like to do is prescribe you with a low-dose antibiotic just to cover for the potential of any bacteria having been introduced into your system, given that the eyelash was in your eye for over a day. And actually, before we do that, I'm going to do one more thing. Put some gloves back on here. It is natural for our lashes to go through a shedding cycle, given that your eye has been irritated for the last 24 hours plus. I want to just make sure that there's no other lashes that are going to find their way inside. So I'm going to use my little spoolie here, and it's pink, courtesy of our dermatology department. I'm just going to kind of brush through your lashes gently, so that way if there's any loose lashes, I'll get them caught in my bristles here, and hopefully they won't end up in your eye later. So you can close your eyes if you'd like. I'm gonna do the other eye as well. You can open. So I do recommend actually using a spoolie every day for a little while to brush through your lashes, make sure that if there's anything loose, ready to shed, that you catch it. So I'm gonna put these two right here for you that you can take with you and use. And then, okay, like I said, I'm going to be prescribing you a low-dose antibiotic to cover for any kind of bacteria that may have been introduced. Unlikely, but we definitely like to cover our bases here. So, have you ever used Levaquin before, levofloxacin? Okay. It's a pretty easy one for most people to tolerate, and it should not be causing any kind of GI upset. It's actually used to treat that preventatively. People take it with them prophylactically when they travel out of the country in places where they may be more likely to experience foodborne illness. So it should be a pretty comfortable one for you to take. So levofloxacin. Fine, and no refills. Okay, so we're going to get that called in for you to your pharmacy, which I see right here is the Walgreens on 85th, correct? Okay, so I'm going to have you use one of these a day for 7 days. If during that time or after that time you start experiencing any kind of redness, swelling, pain, the skin around the eye becomes worn to the touch, any elevated temperature, nausea, vomiting, I want you to give me a call right away, okay? And then we will discuss a plan, most likely have you return to clinic so I can assess you in person. But I definitely want to know, all right? Okay. In the meantime, I would also like you to do your best to keep your eye nice and lubricated. So I definitely encourage you to pick up a box of these. You can also use Visine, other saline-based eye drops, but it's definitely going to help your eye recover and feel more comfortable if you keep it nice and wet. All right. Okay. Do you have any questions for me? Okay. Well, if you happen to think of any later on, feel free to give me a call, okay? Okay. It was really nice to meet you, and I'll check in with you in a few days and see how you're doing. Yeah, I'll give you a call.